So every cancer doesn't exist on its own. The tumor cells don't exist on their own, and they exist within an ecosystem. And the question of the bone marrow microenvironment or the bone marrow niche is critical, especially in multiple myeloma, because we know that the cancer cells don't just grow on their own, and they do truly need the support of the microenvironmental cells. And that includes, of course, the immune cells, but also osteoclasts, osteoblasts, and stromal cells. And for many years, we knew that these are so critical for tumor progression, but now we're capable of dissecting more those small numbers of cells and trying to understand how do they contribute to tumor progression. And we're getting to know that specific subsets of immune cells, macrophages, T cells, are actually essential for that progression. And as we get that information, then we can develop therapeutic interventions that can prevent progression in those patients and potentially harness the immune system so that we can truly understand how can we prevent disease progression, but how to intervene and when to intervene in those patients. So it depends, of course, on what we see as a potential contributor to disease progression, but you can actually envision potentially doing precision medicine using immunotherapy. You can see someone who has a specific subset of macrophages, and these are the ones who are not doing a good job, potentially, and then intervening there. Or cellular therapy, potentially not CAR-T in an early stage like MGUS or smoldering, but potentially other cellular therapies. You can think of even vaccination to try and get the immune system to react again and get a better sense of small numbers of cells. And I think the critical thing is at the smoldering stage or at MGUS stage, the immune system is still intact, and potentially you can use that to harness it and prevent progression in those patients. And it's probably even more important in those settings compared to when you have relapse or refractory myeloma.